time I met someone with Down syndrome, I couldn't understand why he was acting so different. It wasn't until I grew older that the facts started coming together. And I know a lot of other people have the same dilemma. Welcome to Catholic Faith Forum. Today is World Down Syndrome Day. And we'll be discussing Down syndrome. We'll meet our guests when we come back from this break. Stay with us. Welcome back. This is Catholic Faith Forum. I am May, and if you're just joining us, we're talking about Down syndrome because today is World Down Syndrome Day. And I'm here with Dr. Charles Adeogun. He's a general practitioner. Dr. Charles, you're welcome.
Thank you so much for having me.
Okay. I can see the information is about to start popping out. So, do you encounter a lot of Down syndrome patients in your practice?
Yes, we see people with this condition because it's one of the most common genetic conditions that exist in amongst humans. So from time to time, we get to see them in the hospital.
Okay, so what is Down syndrome?
Down syndrome is a genetic condition that results from an error in cell division, a term called non-disjunction. What non-disjunction means basically is that there's a problem with the splitting of the chromosomes, and the chromosomes are the embodiment of the genetic material. So really, Down syndrome brings a situation whereby a person who should have 46 chromosomes, every human is born with 46 chromosomes,
okay.
But usually in people with Down syndrome, they have an additional extra chromosome.
Wow.
Yeah, so
when you say it, sounds like that should have been a good thing, but I see that it's actually not.
Yeah, it should sound like an advantage, but apparently it comes with certain characteristic features that distinguishes them. That's why they look different from other people.
Can you mention some of these features?
Okay, like I said, Down syndrome has a situation whereby there is an extra copy of the chromosome 21 specifically, and instead of having 2 copies of the chromosome, there are actually 3 copies of chromosome 21. And people that have this usually present with some physical, intellectual, and developmental problems. And when this happens, they have some characteristic features that distinguishes them from other people, which can range from having a short stature to a small roundish head, low set ears, almond-shaped eyes, the back of the head is somewhat flat, and then they have a single palmar crease. There's a line across the palm. You know, it's just one.
Oh, wow.
Yeah. And they are also likely to develop some other medical conditions as well. But the distinguishing factor is that they have subnormal intelligence. So that means that their developmental milestone is affected. So as a child with Down syndrome, when the peer group are already walking, they may still be struggling to crawl or struggling to sit up. So they have delayed developmental milestones. And when they are in school, they require some kind of extra care and special tutors to actually put them through school.
But do they have special schools for them, or can they go to schools with every other child?
Well, ideally, they should have special tutors because they are not going to pick up things at the rates their peers do. And then they have some cognitive abnormalities. So what is ideal for them is to go to specialized schools where the teachers are already, specialized in treating children with special needs like Down syndrome, because that's not the only condition. Cerebral palsy are also children with special needs, autism and all that. So it's so essential that all this kind of good support system works together with the family support as well to make sure that their potentials are harnessed and they can be the best they were designed to be.
Okay, what's the basic difference between Down syndrome and autism? Because I feel like a lot of people confuse the two.
Well, autism is not a chromosomal abnormality. Autism is mainly a disease of social communication. So a child with autism is living in a world of his own, so to say. So he has problems with relating with people around. He spends his time just alone. And there's a problem with communication mainly. It is not a chromosomal abnormality, but in Down syndrome, this is a genetic abnormality that has a genetic basis. And you know, people with autism can actually have some very wonderful skills and some very wonderful talents, you know, but people with Down syndrome actually have, like I said earlier, intellectual and developmental delays. And because there's a problem with cognition, they take a longer time to grasp what their peers would grasp.
Okay.
And then they require a lot of patience. So that means people who will be taking care of them will have to understand their condition and be very sensitive towards them. And another important thing is, I think the society should be more accepting towards them and understand them that this is not a spiritual problem or this is not caused by some evil, that it is actually something that is backed up scientifically, that there is a genetic basis for this condition.
I think many people, if you heard in my introduction, many people they don't know what to expect. They don't know how to react when they actually see someone with Down syndrome, because it's hard to comprehend. Just see, this person just looks so different from me. So I think this show will serve as a platform for people to understand more about this. So are there types of Down syndrome, or is it all the same?
Yes, there are 3 types of Down syndrome. Okay. The first type is the trisomy 21, and it is called trisomy 21 because it is caused by non-disjunction, like I mentioned earlier. Non-disjunction is a problem that results whereby the chromosomes fail to separate completely. So usually in trisomy 21, as the name suggests, there are 3 copies of chromosome 21. That's the trisomy part. Okay. And then chromosome 21 is the affected chromosome. So that's why it's called trisomy 21. And this is the commonest type of Down syndrome. It accounts for about 95% of all cases of Down syndrome.
Wow.
Yeah, and then they have all those characteristic features that we mentioned earlier. Then the second type is the translocation Down syndrome. The translocation Down syndrome accounts for about 4% of the total cases of Down syndrome. And then although an extra copy of chromosome 21 exists, it does not exist independently. It is actually attached or translocated to another chromosome, usually chromosome 14 or 22. And, you know, they still have those features as well. Then the third type is the mosaic Down syndrome. The mosaic Down syndrome accounts for about 1% of the total cases of Down syndrome. And then this type, as the name suggests, is like a combination. So you have some cells that have the 3 copies of chromosome 21, and then you have the normal cells that contain 2 copies. So it's like you have a mixture of them. But this type, the people that fall into this category have a milder form of Down syndrome because they also have normal cells.
I was going to ask you if there's one of these types is better than the other.
Well, we can say the mosaic type is milder in the features.
But it's still less common, which is...
yeah, it's actually the minority.
Okay, so how is Down syndrome diagnosed? Okay.
Down syndrome is actually diagnosed through something called prenatal diagnosis. Prenatal diagnosis is a part of medicine that helps a pregnant woman find out if the baby she's carrying is at risk of certain conditions. So you're able to make those diagnoses prior to birth. So they are divided into 2 categories for Down syndrome. You have the screening part and then the diagnostic part. Okay. The screening part has to do with the mother who is at risk of having a child with Down syndrome because she has risk factors. Maybe like she has had a child before with Down syndrome, or she's advanced in age.
Okay,
and all that.
I was going to ask that because a lot of people said when a woman has a child, when she's above, let me say, the common childbearing age, she's at higher risk of having a child with Down syndrome.
Yeah, so those are the people that are good candidates for a screening test. So she goes in for a screening test, and the screening test includes 2 basic parts, which are taking the blood sample and checking for concentration of certain substances in the blood. And then the other part is the scan, the ultrasound scan. So talking about the blood, you have certain substances which include alpha-fetoprotein.
All these names.
Alpha-fetoprotein, which is markedly reduced in babies with Down syndrome. So if a woman is carrying a baby that has Down syndrome, the alpha-fetoprotein levels will be reduced in her blood. And then another important thing to check out is the human chorionic gonadotropin. Wow. That is another hormone, and the levels are markedly elevated if a woman is carrying a baby with Down syndrome. And then you also have unconjugated estriol. That level is markedly reduced in women that carry Down syndrome babies, and inhibin A is the fourth substance. It is also very increased in women likely to give birth to Down syndrome babies. But the scan is something that at least is visible, and then the sonographer or people who are observing the scan can actually see some basic things that can be a very good indicator of a child who is at risk. Talking of the ultrasound scan, it's important that when the ultrasound is done, at about 20 weeks, there is usually a characteristic appearance of a fluid collection at the back of the neck of the child.
Oh, wow.
Yeah.
So from that early on,
Yeah.
you can see.
So when that is seen, it tells the sonographer that there is a likely genetic abnormality in this developing child, and then that now makes them send her for further diagnostic tests, and then those diagnostic tests would now actually confirm if their suspicion is correct or not.
Okay, you mentioned a lot of medical terminologies and big words that I'm sure I don't know if I can pronounce it unless I practice and practice over and over again. Yeah. So how do you explain Down syndrome to someone who is like less, not as educated or enlightened, for women to know how to take care of these things?
Okay, that's a good question, because in our environment, we meet with different kinds of patients. Some people are not as enlightened as other people, but we try our best to come to everybody's level and to try to tell them, okay, instead of mentioning all those big names, you just tell the woman, because of a prior history of this child you've had that had Down syndrome, you're at risk of having another child. So we just want to err on the side of caution. So we would ask you to do some blood tests. We just want to check some specific things in your blood. We don't need to go into the details of what we want to check. But after evaluating the result, then we can get back to the woman and tell her, okay, we think you're at risk of it, or we think your risk is minimal.
Okay, so can Down syndrome be cured or managed?
Down syndrome cannot be cured. Down syndrome is a genetic condition, like we said. Like sickle cell anemia is also a genetic condition. Most genetic conditions, there's really nothing you can do about it, because the genes are deeply ingrained in the personality of the individual, and everything around the person is based on a genetic basis. So whatever we inherit from our parents, or whatever forms the genetic basis of our existence, cannot be reversed, but it can only be managed, and it can be managed well.
Okay. So what is the frequency of Down syndrome?
Okay, globally, the frequency of Down syndrome, some studies say it is about 1 in every 1,000 live births. And in Nigeria, it is estimated to be 1 in every 865 births, according to a study that took place in 2009.
Okay.
So usually we can assess from that frequency that for every 865 child born, somewhere along the line, there may be one child who will develop this condition.
Okay, so can it occur in just anybody, or does it have to be inherited? Does it have to be hereditary, or how does it occur in people, basically?
Well, as I said earlier, it's a chromosomal problem, and then once there's a problem with having the additional chromosome, which nobody can actually predict how it's going to happen or in who it is going to happen, you just see it.
Okay, so unlike sickle cell and the rest, it's
where you can have a very good predictive situation. Well, it's something that you have to watch out for the risk factors, the advanced maternal age, and then some new research work are actually showing that advanced paternal age too may be contributing.
Oh, wow.
So that means that advanced maternal age above the age of 35 puts a woman at an increased risk of having a Down syndrome baby, or if she herself is a Down syndrome patient, she has a 35 to 50% risk of having a child with that. But you can now imagine if somebody above 35 years old, a woman, gets married to a man who is also advanced, then their chances
are way higher.
Exactly.
Oh, that's scary. So do people with Down syndrome have increased health risks?
Yes. People with Down syndrome, apart from the intellectual and developmental problems, they are also at an increased risk of developing a constellation of illnesses, which can range from hearing loss to ear infections to eye diseases to heart problems, because they can actually have problems with the partitioning of the walls of the heart. So they can also have cardiac issues. And another important thing that they can have is that they're at risk of having certain types of cancers too.
Oh, wow.
Like some leukemias, and then some of them can also have some kind of gastrointestinal abnormalities, like failure of canalization of the duodenum. And then they can all, even when they grow up, they have an earlier onset of Alzheimer's disease that makes people forget things, lose their memory and all that. So they have an early onset. So at an earlier age than most people, people with Down syndrome can actually develop Alzheimer's disease.
Is it possible that someone that has Down syndrome can have a normal child?
People with Down syndrome, actually, their fertility is gender-based or is gender-related, so to say. A male with Down syndrome may find it very difficult to actually reproduce. But women that have Down syndrome can actually be fertile. You know, like half of them can be fertile and actually have children of their own. Like I said, they still carry a 35 to 50% risk of having children with Down syndrome. But for the males, there's some studies showing that there is associated problem with spermatogenesis, that's a problem with production of sperms.
Yeah.
And then also they are also at an increased risk of being ignorant about the sexual act. So,
oh wow.
Because you know cognition and everything is
Yes.
affected. Yeah. So.
Okay, so what special care should be given to people with Down syndrome? How do you manage it? Say, for instance, I have a younger one at home or a neighbor's child around me that has Down syndrome. How should we take care of that child?
That's a very important question because that is what a lot of people should pay attention to. Having a child with that, we know it's enough of a big problem, you know. A lot of challenges are associated with that. So basically, good family support is essential. And the family, you know, is one of the best support systems you can have.
True.
So they have to show a lot of love and affection, that from the parents and the siblings and the people around. And then, of course, the society should be more accepting towards them, like I said earlier. That's very important. So people should try not to emotionally abuse them or psychologically abuse them or even sexually abuse them because they are very vulnerable because of their condition. And as we know, early intervention always produces good outcomes. Okay. So the earlier an intervention comes in, the better the outcome. So a child with Down syndrome, right from an early age, should get all this support and should also get a speech therapist come in to help with communication skills, should get an occupational therapist to come in to help with functioning and the ability to carry out their daily routines and activities. And then they also need a physical therapist because there is something called generalized loss of muscle tone in people with Down syndrome. So they look floppy and all that, but physical therapy and all that can actually help them. And then special tutors. They need special tutors who would actually see them through whatever education or vocation they're going through to make sure that they're very patient with them and then they can see them through all the different stages of education so that they can be the best they can possibly be.
So is it possible for someone with Down syndrome to actually live a normal life, like fully integrated in society and just live?
Yes, because like I said, early intervention produces good outcomes. So a lot of cases whereby, you know, there are early intervention, good medical care, and all these specialized care are put in place, the outcomes are usually better. Like, for instance, currently, the life expectancy of people with Down syndrome is about 60 years, which was not like that some years back. You know, so that means that they can actually do well, live normal lives, and then some of them are good enough to even sit in a class and write exams. And they do so well. So all hope is not lost with Down syndrome. And then, as I said, we need to emphasize on early intervention and all the key support systems must be in place so we get the desired outcome.
Okay, thank you so much, Dr. Charles, for sharing information with us on Down syndrome. There's so much I did not know. I'm sure there's so much all of us did not know about Down syndrome. People with Down syndrome should not be treated harshly. They should be loved and cared for like everyone else. We are all God's children and God loves us all. Let us cue to Collins for today's episode of Know Your Faith. Stay with us.
Hello and welcome to another awesome and interesting episode of Know Your Faith series. I am Collins and today we'll be talking about the gospel formation. We all know the Gospels. Yeah, so how were they formed? And that's what we're talking about on today's show. So the Gospel consists of the first 4 books of the New Testament, which is Matthew, Mark, Luke, and John. And the term Gospel is gotten from the Anglo-Saxon term gospel, meaning good news or good story or good telling. Okay, the first 3 Gospels, which is Matthew, Mark, and Luke, are referred to as the Synoptic Gospels. And this is simply because when you lay their texts like next to each other, you find out that there's similarities between the writings. But however, John is narrated quite differently. So we recall that the Gospels, all of them came after the resurrection and ascension of Jesus Christ. So they were written with the end in mind, essentially, knowing that Jesus came to defeat death and sin. So the Gospel, in other words, records the life and teaching, death and resurrection of Jesus as told by the disciples who knew and loved him. So it is essentially a story of Jesus told in faith and for faith to inspire us to believe in him. So we know that not everything Jesus said at the time, or if you read the Gospel, you realize that not everything he said at the beginning was really understood or he did. For example, when he said that he was going to destroy the temple and rebuild it in 3 days, the disciples did not really understand what he meant by that, not until later on. So how were the Gospels formed? In the CCC, in paragraph 426, tells us that there are 3 stages of the Gospel formation. First is the life and teaching of Jesus. So basically this simply relates to the life and teaching of Jesus depending on the witness of the apostles, members of his intimate circles. So these were stories passed on from essentially from Jesus himself to the apostles, all he said and all he did. Second stage is the oral tradition. Now this came after the ascension. Enlightened by the Holy Spirit, the apostles preached boldly, and if you can recall, that is the day that is referred to as the birth of the church. They wanted to know who he was and have access to the mystery of God's life through faith in Jesus and baptism. And the third stage is in the written Gospels. So the writers selected both the oral and the written materials to prepare this text, all being inspired by the Holy Spirit, organizing all that they had heard in order for them to write effectively to a diverse audience. We know that the Bible has not been changed right from the beginning of time, right from the beginning till now. So it was written in such a way that irrespective of time, people would be able to relate and understand. So if we look at the time range of the first gospel was written between 66 AD to 70 AD. Yeah, I mean, if you look at it, Jesus died 33 AD. That's like a difference of 33 to 37 years. So this tells you a lot that the Gospels were not rushed in any way, but they actually took their time to write all that had happened. Okay, so that's it for today, guys. Here's a question for you. Please, I already stated that the first Gospel was written in between the years of 66 to 70 AD, right? So what was that Gospel? Please find out and let us know in the comment section. Until I come your way next time, be bold and be Catholic.
Welcome back. That was Know Your Faith for today. Hope you enjoyed it and hope you enjoyed our episode of the show today. World Down Syndrome Day. Please take care of, if you know someone with Down syndrome around you, treat them with love and care. Any final words for us?
Well, my final word is they are part of us, they're part of the society, they are our brothers, they are our sisters, they are our loved ones, and we should treat them as such. We should show them so much love and compassion. Thank you.
Okay, thank you so much. For questions and inquiry or anything you want to tell us, just hit us up on our social media platforms at CFF on TV. Also subscribe to our YouTube channel, Dominican Media Presents. Also join us on Tuesday at 7 p.m. for our CFF chat room with the hashtag CFF chat room. Okay, and our question for the week is, how should families treat children with Down syndrome? We'll see you there on Tuesday at 7 p.m. Till next time, keep being saints in jeans and shirts. Bye.
For people with Down syndrome are more of having a lot of decline in intelligence and
Can I just pick up from which one? From Down syndrome, you've explained autism, so it's like,
okay.